Good morning, everyone. Happy Friday. Here's one more Friday talking about oral health. And our topic will be about oral hygiene and what are the keys to prevention. Thank you, Dr. Munné, for being with us today.
Yes, absolutely. Thank you, Adrian. And I think that's a very important topic to discuss because as we start the year, we want to start with a good foot forward and make sure that we do everything in our power to make sure that we don't have any problems, right? And that's just the whole, purpose of preventive medicine, preventive dentistry, preventive periodontics. So we want to make sure we spread the word and we let
That's
you know
right.
what are the key things that we can do so you can stay ahead of the game and not get into pain and unnecessary treatments that they could have been avoided that of course they're not going to become necessary if they haven't been avoided, but that we can be healthy and stay healthy. And on that note of prevention, I'm going to go over several things. I know we don't have a lot of time and we could expand a lot on
Mhm.
each point, but the number one prevention is going to be oral hygiene. And I think that one of these upcoming chapters will be on how to actually brush your teeth. And I want to share that with you just to make sure you
Good.
have the proper information coming from a periodontist on what can you do to make sure that you're brushing correctly and you're not hurting your teeth, but also at the same time you're very thorough and you're just getting the results that you need because the oral hygiene, if it's done correctly, it should prevent that you have any problems. So a lot of times, we do have decay, periodontal disease because, our hygiene is not enough for what our needs are. And everybody's different, right? Because everybody has different immune system and the
Correct.
immune system is key, so that a lot genetics play a big factor in our lives. And if we are predisposed to something, there's still ways to avoid it, but we might need to do more, right, to compensate for that lack of our immune system, our, defense mechanism in our body. So oral hygiene, I would say, should be number one. Number two, I think our diet is very important. To have like a wellness plan of diet and exercise. And there's some articles that have pointed out that people that stay fit also, they have like better oral health as well. So probably because they also take better care of themselves and maybe they watch their diet, but what we eat is important to our body. Of course, if we have a diet that is very rich in sugars and is very rich in acids and alcohol and things that are going to be damaging to the enamel, or they're going to bring a lot of bacterial growth, that's going to make our mouth more difficult to maintain, and we're going to have to even increase a lot more what we're doing to compensate or use products. So using a healthy diet that consists of natural fruits and vegetables and
That's good.
good protein, and make sure that we nourish ourselves in a healthy way, and we have like a wellness program with exercise and good sleep, good rest, that always goes a long way as well. Having supplements, vitamins and minerals, they're important. So if our diet sometimes, we're all trying to keep our weight down, right?
Right.
So we need to make sure that also we do have like a plan on supplements that our body might need to make sure that we maintain, good vitamin C. That's the building blocks of our collagen, our soft tissue, our bones, and calcium and vitamin K and vitamin D and etc. Right? Just have like a good balance, and all minerals as well, potassium, calcium. I mean.
Mhm.
Magnesium and zinc, and there's a whole, and we can expand a lot, but I think that that's important as well. I like personally, to talk a little bit about toothpaste. A lot of patients ask, which toothpaste should I use, which
Very important.
mouthwashes should I
Yes.
use. So I think that the most important one we brush is the brush, is the
Mhm.
toothbrush. The toothbrush and the technique that you use is going to be the 90% success of your brushing. So if you use a brush that is soft, extra soft, and you use a good technique, and we'll talk more as I mentioned, and I promise in these upcoming chapters, then right there you got 90% success. Now, adding a good toothpaste to your routine, I think that is also very important. I personally like to stay on the natural side. I do like
Mm,
fluoride, and I think fluoride has been, shown in research how, it protects our teeth. I think that nowadays, fluoridation in the water is
mm,
probably not happening for anybody because nobody drinks tap water,
mm.
and if somebody drinks water from their sink, usually they have a home filter. So I think
That's
that
correct.
the most
Mm,
people drink bottled water. So I think that fluoridization in the water doesn't reach the public. So it might be an effort that should be maybe directed in a different way. But I believe on fluoridation in your toothpaste that is not absorbed by your body. It's going to stay in your teeth, and it's going to help reinforce the enamel because our enamel has a very high percentage of fluoride on it, and is what makes your enamel strong. So it's going to make it more resistant to be decayed by bacteria. Also makes your teeth less sensitive to cold. So there's a lot of benefits of using fluoride. And then other than that, I like toothpaste that they're not abrasive, that they're not going to cause a lot of, tooth wear. That I prefer that we brush
mhm.
longer and that we don't use an abrasive toothpaste. And then
Any brands,
yes,
Dr. Monet, that you recommend?
I do not recommend brands in here in a public
Okay,
setting. I'm not endorsing any brands. I'm not, being paid by anybody. I think that
that's correct.
there's good products out there, and you just need to do your research or talk to your dentist and maybe just discuss it at that level. And then of course also regular checkups. I think regular checkups are very important, and that's just going to your dentist regularly. Don't delay it because
That's
delay
right.
it is what's going to cause more problems. And maintaining your cleaning appointments on time. Everybody should have a cleaning every 6 months, and if you have gum disease, you need to have one every 2 to 3 months. So if you stay on the program and you do all these other things, I think you're going to be preventing a lot of problems and saving a lot of money at the dentist, because
That's
the
right.
cheapest dental appointment that you'll ever have is having those cleanings and not needing to do additional treatment. And of course, a very important recommendation: do not procrastinate. If you know that you already have dental needs, you have cavities, you already know you have cavities, just take care of them now. Don't wait for next month, because then might be a cavity and a root canal and a crown, and then cataching, everything always starts becoming more expensive. So doing it today, it will be like your cheapest option and your
Yes,
best option.
that's correct,
So
Dr. Monet. Thank you so much. Is there anything that you would like to add about oral hygiene? As you mentioned, you cover a lot about keys to prevention. And next week, we're going to talk a little bit more about how to brush our teeth. And then we're going to go step by step on some of the most important things on oral health. Thank you so much.
absolutely, yes. And please do not forget to like us and
That's
give
right.
us comments. And go to our website, Healthy Gums Four,
Well,
number four, all. Go there and search us and find us on Facebook and TikTok and